this will be a fascinating event. First, I will start with introducing of my co-moderators. We have two co-moderators, Professor Abdallah Jira from Pennsylvania, USA, and Professor Ghada Al-Qanishi from Mansoura Nephrology and Dialysis Unit as well. Just to give you a small reminder about this event, we have started our collaboration with as a part of the scholarship program with Kentucky University, and we have the first CME event a couple of months ago, exactly on the last 27 to 28 last Jan. And actually the success of this event and the success of this meeting and your contribution and precious comments give us a very forward push to organize for this 2 days course. And this 2 days course will be under the title of Glomerulonephritis Part 2. Today we will have a very interesting lectures and case presentation as well. Also, I would like to turn your attention to the agenda. It is presented here on the screen, and during these 2 days meeting we will have 4 plenary lectures by 4 eminent speakers in the field of nephrology and glomerulonephritis as well. We will have 2 lectures a day. Also, we'll have 6 interesting cases and with their interesting discussion as well. We really, after the first meeting, put some thoughts trying to figure it out actually. A very effective participation, not only to hear from you, but to hear and to have your eminent discussion as well. So, hope we all can enjoy this course as well. Just a reminder for the attendee. Please, those who are willing to collect their certificate of attendance, they should have attended at least 70% of the activity of the course, and please fill the feedback form which will appear in the link in the second day of the course. This is the agenda of the course. As I told you before, we will get started with a quiz of 8 questions that will be presented by Mohamed Mamdouh. And at the end of the course, every day, we will present the most appropriate answer just to test yourself, what you get and what is the benefit of this course, and to test your knowledge from this course. So please, at the start of the quiz, write your answer down in a paper and compare this answer with the appropriate answer at the end of the course. Dr. Mamdouh, can you please start presenting the 8 questions of the quiz?
Yes. Welcome everyone. So I sent all of you like the link to the quiz in the chat box. You can click on this link and it will open the quiz as this. You can try and put your answers. We have 8 questions. The first one is, which of the following represents a prominent histopathological abnormality in primary FSGS? Endocapillary proliferation, immune complex deposition, food process effacement, crescent formation. Second question is, which of the following is the best prognostic sign for FSGS progression? Circulating levels of permeability factors, the histopathological light microscopic pattern at diagnosis, the degree of proteinuria at presentation, initial treatment responsiveness in proteinuria control. Third question is, which of the following FSGS light microscopic pattern is the most reported with COVID-19? Tip lesion, collapsing, perihilar, or non-otherwise specific? Question number 4, which of the following raises the suspicion of a secondary cause for FSGS? Typically presented with nephrotic syndrome, diffuse food process effacement, insidious disease onset, recurrence after kidney transplantation. Question number 5, Which of the following drug is a second-line treatment in steroid-resistant FSGS? Calcineurin inhibitors, rituximab, methotrexate, or cyclophosphamide? Question number 6. 14 weeks pregnant lady presented with 2 weeks history of leg swelling and 24-hour urinary protein 3.6 gram per day. The most likely diagnosis is eclampsia, preeclampsia, FSGS, post-streptococcal glomerulonephritis. Question number 7. Preeclampsia can be diagnosed after 20 weeks of gestation if new onset blood pressure equal or more than 140/90 with platelet count 9,000 without proteinuria, or proteinuria 4 gram per day without hypertension, or renal impairment with proteinuria and normal blood pressure, or platelet count less than 100,000 without other manifestations. Last question is, which one of these immunosuppressive drugs can be cautiously used in pregnancy? Cyclosporin, cyclophosphamide, mycophenolic acid, or chlorambucil? We will let the form open maybe for more than 10 minutes, and you can answer this form, and at the end of the today course we will give you the link again, and we will record your second response, and we will see if the percentage of correct answer in both of them.
Thank you very much, Mamdouh. Again, as I said before, please try to answer this question and leave the answer till the end and compare this answer with the most appropriate answers that will be presented by the end of the day. Really, I have the honor to present the next speaker. The next speaker is Prof Alaa Sabry. Prof Alaa Sabry